What are you doing there, Corey? Trying to hide from me?
A little bit there, John, but you know I can never do that.
No, yeah.
You always find me.
Uh-huh.
You want to know what we're doing today or what?
Yep.
We're going to go up to quarantine. We got a few horses in the covert auction over the weekend. So we're going to get them checked out, and I think we have about 6 more to do up there. So it's going to be a busy day. Sorry. For some reason, our scale decided not to work today.
Because it's not plugged
Oh, wait,
in.
you know what? If it was plugged in, it might help. So we're going to slowly figure it out. It is Monday.
Vet tech and handyman.
I am pulling up vaccines for this mule. If you leave them, if they're in warm temperatures or they sit out for too long, they lose their effectiveness. So you want to keep them refrigerated as best you can.
I always listen to gut sounds. You got to be pretty careful with some of these auction horses because a lot of them haven't been handled or don't like to be touched. Gotcha. This guy is pretty chill. If you wanted to listen to lung and heart sounds, I'm comfortable with that. Braxton is a veterinary student from the University of Georgia. One of Braxton's professors is one of my friends and colleagues, and Braxton wanted to get a summer clinical hours that was really diverse. So he's been working with Dr. Scott at Doc's Clinic, and he's been here at Horse Plus with me last Monday and again this Monday, and he's also been out at the Elephant Sanctuary. So he's gotten to see a lot of species of animals, and he's had his first year of anatomy and normals, but hasn't had any of those abnormals yet. So we're just trying to get him lots of opportunities to see a lot of different things, and that'll help him in vet school. This tool is called an ophthalmoscope. It can also be converted to an otoscope. So those are just fancy words for eyes and ears. So we like to evaluate their eyes for any chances that they have a cataract or an old corneal scar, anything like that. And this guy has great eyesight. So we're just using the opportunity to show our vet student what we would expect to see in an equine eye.
Is that really a rock or is that a growth?
That's a rock. So this probably does not feel good to him. So when horses step down, their feet will actually kind of expand out when they put pressure on it. So that's how they can get rocks stuck in there, and then when they pick their foot up again, it contracts back down. So yeah, I've seen that happen before. It's pretty set.
There's no crackles or wheezes.
But it just means that he's struggling a little bit more to breathe.
But you can perceptibly hear. Can I listen down here? What do we think about this? And so the lung sounds are elevated enough that you actually can hear them even from lower lung fields. You can just hear, it doesn't sound like struggling, but you can hear breathing.
Younger than 10, I'm thinking, huh?
Younger than 10. I would say between 6 and 8.
7?
Yeah. Whoa. Feel how much heat was released right here. So start right there and feel here.
Holy cow.
You can feel how much heat was released, and then he had another vertebrae stuck right here, and then more, oh yeah. When, whether it's a primary bony problem or a more related to muscles and soft tissue, when they've got injury or some chronic misuse, you can get a lot of stiffness, and that can affect the spine's ability to move through its normal range of motion. And so giving them the opportunity to release basically an area that was stuck, you can palpably feel the heat release when that happens, but then it kind of resets it back to baseline. So if you've ever been to a human chiropractor, they do a lot of talking about normal anatomy and things being lined up where they're supposed to. This horse had really minor issues and really easily moved his own back himself, but then he showed a pretty strong letdown response afterwards that was a positive. Endorphin release is something that's really positive for them.
I have dewormer, electrolytes, and probios.
So this blood is testing, it's a Coggins test. Coggins is the term for a disease called equine infectious anemia. That's a reportable disease. So any horse in the United States that's going to be transported anywhere else needs to be tested for Coggins. And so that's something that we do here as a part of our regulatory paperwork. She's got a little bit of some abdominal sagginess, which could have been from previous pregnancies, but just because she has an unknown history and we've got her right here, we're gonna make sure. Oh, she's got really bad diarrhea.
Ew. Do you want any gloves there?
And it smells like it won't matter. It'll come straight into my glove. I'm sorry, girl. So we'll do a fecal, and if she's loaded with parasites, I'll deworm myself as well. No positive signs of pregnancy. She has pretty decent teeth.
Looks like someone actually took care of her.
Yeah, it looks like her teeth have been floated. Her teeth have definitely been floated. I have zero problem with radiographing her feet. I don't think she's cushingoid. I think she has malnutrition going on that's secondary to malabsorption. I think she's been pooping out her food for a long time, and we need to get the diarrhea under control, and I think we'll see her hair coat improve. Let's take a radiograph. We've got everything right here. Let's go ahead and get set up. Braxton got to see the horrific.
Flip it. Yeah, like that.
I'm trying here, John.
There you go. We'll get it. There's only so many ways.
Okay. It is still Monday. I would just like to point that out.
It's not because it's Monday.
Is it Monday?
Ooh. This is the pastern bone, and we've got some arthritis that's bridging between these two bones.
Is that like fused right there?
It's hard to say if it's fully arthrodesed. That's the term for fusion. What's nice is this is a really low motion joint. So if that degree of arthritis were present up here or right here, we could potentially have a lot of pain on each step, because this is basically right outside the hoof capsule. That joint doesn't really move a whole lot. So she's probably pretty pasture sound and doesn't have evidence of arthritis up in these higher joints. Let's go ahead and take a lateral of her other foot. Some roughening in the same areas on this foot, on the pastern and the coffin bone, but they're not as significant as the other side. So I would say she's not a great candidate for rideability, but for pasture soundness, she should be in pretty good shape unless she's clinically lame.
No riding for anybody, or like only small?
I think that she could accommodate a light rider, but that depends on a clinical lameness exam. We need to see how this mare moves, which we kind of can't do right now because she's sedated. Her other joints look really beautiful for her age, but I wouldn't put like a adult man on her.
She was actually surprisingly better than we expected. She's a little older. We did a preg check on her. She's not pregnant. We did a dental exam. Her teeth have been cared for, so she didn't need a dental today. We also took radiographs of her front legs. We took one of her front left knee and both front feet, and everything is looking good. She can't have any heavy riding, but other than that, she's got a really nice prognosis.
She is getting stated to do a dental oral exam, see if she needs to get her teeth floated. Her teeth just seem a little out of whack, so we'll see what Dr. Lydia thinks.
If my guess is correct, this mare has some pretty significant points, and so I want her to be comfortable. Awesome. Can I have that syringe, please? Really? You did so great, girl. So before, she couldn't move her jaw back and forth, and now she can do that pretty freely. So those points that were keeping those teeth stuck, she can use those now. And actually, her position right now is perfect for a stifle rad. Love it. So here's patella, femoral head. Ha! There's our lesion. See it right there? Little chunk of bone, probably where a soft tissue insertion happened. That looks really old to me. It's like all soft tissue. Awesome. Cool. No reason why this mare couldn't be evaluated for soundness purposes. Whatever happened to this stifle happened a long time ago. she does look like she's not sound on it. So we might have some soft tissue damage there that we're not evaluating yet, but she's gonna be able to chew now.
So we are all finished in quarantine. We ran everybody back through that didn't get Coggins pulled or vaccines. We also did some deworming. There was a couple horses that we couldn't catch last week in the 10 acre that we were able to catch this week. So we are running them down, and then we also did some radiographs and dental exams. So we had a good day up in quarantine, and now we are headed to go get lunch.
Peyton from Christian Farms Rescue and Rehab is here to do a shelter transfer. She's going to be looking at quite a few horses today.
She's like a small pony, large mini size. She's cute. This guy might do great once he gains more weight. He's actually gained probably about 150 pounds since that picture. Unbranded. So it's like a Mustang, but it's not a BLM Mustang. Unbranded. We're just showing horses to Peyton. It's Christian Farms Rescue and Rehab. They come periodically to transfer horses to their organization. Sometimes we take some of theirs too. It's great to network with other rescues so we can get more horses adopted. You want to take her?
I think so. We'll put her on a most.
I'll give Angela the ones y'all are for sure, or for the most part.
Who's this guy?
That's the one that enjoys bucking under saddle.
Oh, really? Honey, are you mean?
She came up to me up in quarantine before.
I feel like if we put the baby with the older mares that we have at the house,
yeah,
it'll work a lot better. If we put the baby, say, with Moon, I think the baby feeds off of the other babies. Well,
yeah, they're both babies.
White Sox. I'm sorry, what's...
Yeah, the White Sox is Star. Yeah, Star.
So the one without the fly boots, Firefly, she's pretty well gonna be the tamest of the babies because the babies up there don't want anything to do with anybody. I mean, I like her. I like Ray. He reminds me of Todd. But she's small enough she'd be more of a companion pasture pet.
Hi, dear.
This is Lucy. She's also, well, she's got a lot of interest. She just had some soft tissue issues with her legs.
Oh, Lucy. I thought you already passed me by, Lucy.
So Lily, Ray, Firefly, and America. And you already have the other two? Okay. So Peyton is done looking at horses down here, so we're gonna head up to quarantine to look at more horses.
Craziest thing on the property right now. If you can't tell.
She's not halter broke because she doesn't need to be, right? Isn't it cute?
Oh no. I got that.
Oh, maybe it is.
That's a yes, right?
We don't see you anyways.
Put on your sleeve.
She's cross-eyed. There is a photo posted of the dog earlier, and it is smiling just like this.
She's cross-eyed.
Just cross-eyed as can be.
Honey, you are pretty good. No. Say yeah. You and your little cross-eyed
Say
self.
yeah. Say yeah. Say okay.
They posted this photo earlier, and that's all I said underneath it was, I said, those are some crossed eyes. It's the sweetest little crossing. I think she's adorable too.
Then let's just start at the top over there because I'm gonna leave these spaces for the 4 transferred dogs and you can start up there.
Yeah, it's been something this month. We've had a lot of adoptions go out. Kimberly's definitely been busy. So Peyton from Christian Farms came out today to get some horses for a shelter transfer. She is taking 4 home with her today, and she has a transporter coming tomorrow to pick up the rest.
Bye, y'all.
Bye. Take care.
So we have some adopters here to look at snow today. The adoption appointment went great. I got the guy to come in and handle snow a little bit, and I got to talk to the trainer that they are using, and ultimately I felt great about the adoption, and I'm happy that Snow found a new home.
They're adopting Snow and Bryce. If y'all want to find their pictures on the wall over there.
So we found out about Horse Plus Humane Society, about people that live in Savannah that have horses. They recommended you all. And I've worked with Humane Society before in California, so we just didn't know you all did horses.
And then we found the horses that we found. I found them on the internet and was looking at them, and I've been watching them for 2 weeks now, and then put a hold on Bryce so I could catch him.
Yeah, she's been watching every day. So we both looked on there and make sure the horses were going to be here, and we watched how Corey did a lot of the work with Snow and the groundwork. So we're real pleased with everything today. They answered all our questions. They did everything that we asked them to do, and they told us the horses could work if they had any.
I'd recommend anybody to come here.
Yeah, I would too.
Morning.
I'm back. Look out, Jack. Here I come. Well, sometimes you just had to cut back for a while and let your body heal up a little bit. I might have been running my AC too much.
Maybe, right?
Yeah, I didn't know who all these people were standing around here. Well, she's still here.
Sailor.
She's still here.
Jenna's here.
Jenna's here. Where you been?
I'm gonna get payments before you do this for us.
Oh, okay, go ahead. This is a nice little horse. A little bit of groceries on here, you'll be good to go. You'll be good to go. Turn around. Turn around, I'm gonna show you a little trick. There you go. Brake channel, brake channel. This is a horse shoer over in the big barn with the big horses. The thermostat on the wall stuck on like 95. Need it brought down to 72. Over and out. Nobody heard me.
He's back.
I'm here.
Jenna, what do you got? Shoe flies.
All right.
Help keep the flies off their legs and reduce fatigue from stomping.
Whoa, baby.
Ma'am.
No biting today.
Garrick, I'm gonna clean this whole barn for you, and you're gonna
Still do it in the one pile poop.
I know, I don't know why you stopped right there.
I came to check on you. You know, everybody's been asking how you've been because you've been gone so long. So
Here I am.
I know it. As the person who checks on the messages, I just came out to check on you and make sure that you take it a little bit easier there.
What are they saying?
Oh, where's Garrick? They miss Garrick. Now they all agree when Kayla comes in. I mean, she's pretty bad to be slinging them horses around the little tiny thing she is, but they all miss Garrick. So
I do the easy stuff and I leave the hard stuff to the pros.
I know. Well, we're glad to have you back. You definitely were missed. He missed it. Well, we are glad to have you back. I just wanted to come and say welcome.
I'm just old and wore out, you know.
Hey, we all are.
So Ruger was an owner surrender. When he was surrendered, a little history on him was that he got hit by a truck when he was younger. He's got 9 right now, so he has fractured withers and a couple of puncture wounds on the sides of his neck. Hi, Becky.
So he's just a pasture pet.
Yes.
Alright.
On these horses like this is, you can tell he doesn't like his feet messed with, but you can trim him and you can do it safely without him kicking you. But he hasn't tried to kick yet, he's just trying to get away. Pretty good day. Everybody's got good feet. We're gonna have this one horse looked at again in our backs. Ruger done well. He'll make somebody an awesome little pasture horse. He's got good feet on him, good and solid. The little black horse up here, she done really good. And the little one with the pink socks on, that's a nice little horse. That will be a good one for the pasture. Old horse, but still a goldie. Oldie but goldie, kind of like me. Getting old, but I'm still gold, you know what I mean? So, it's just 10 o'clock and I'm already soaking wet. Welcome to Tennessee. It ain't the heat, it's the humidity. But all in all, a good day. So, back to Horse Plus, signing off. Best part of the day.
What time is it, Garrick?
You all know what time it is. It's sun drop time.
Yeah, buddy.
So I seen the sun drop guy the other day, he said he's gonna get me a cap. I said, you be best interest to as much as I advertise sun drop. So, for those of you that watch this and don't have sun drop where you live, I would boycott everything else so they would bring sun drop in. It's well worth it. Well worth it. You can't beat them. Oh yeah. Naturally flavored citrus soda. It's natural. It's good for you. That's stickweed. You gotta have them.
Gotta have it.
I mean, you don't want to drink like a bunch of these in one day. I don't recommend that, but a lot of water, 1 or 2, it gets you by.
Okay. See ya.
See you later.
Bye.
Have a good one.
All right, we're headed off to auction, see what kind of animals are there, just so we can kind of prep what horses might need medical care after the auction. So hopefully it's a great one. We can save a lot of lives.
See you later.
Hi, guys.
We are going to the auction tonight in Cookeville, Tennessee.
All right. The whole crew loaded up.
All ready?
Bye, guys.
Right here, the auction right now. I don't know what's wrong with the leg, but it looks very not normal. Right.
We just got here to the auction, did our initial walkabout, and there is a horse that is so bad that her front legs are crossed and it's bowed out. We were able to figure out who had the horse so we could get it behind or from whoever had him, so she didn't have to go through the ring. And we are making the decision to find the vet that's here tonight to euthanize her and give her the last act of kindness, because there's no reason that horse has made it this far to this auction, but there's no reason that this horse ever has to get back on a trailer and endure that kind of pain. So we're gonna go give her pain meds right now, and then we're gonna get the vet to do that for us.
How many horses are there today?
I lost count around 85, and they're still bringing more in, so my guess is there's going to be over 100 horses here tonight.
I do need her head up if at all possible. Oh, this horse is so dehydrated, it's disgusting.
Yeah, it is.
Look at her, she's like eating the dirt just to get some hay.
We gave her a lot of IV pain meds to try to make her as comfortable as possible. We're getting hay for her right now, just to try to keep her as comfortable and happy as possible. And then as soon as the sale is over, we are gonna give her the last act of kindness. That way we don't have to try to walk her anywhere or make her move, but we are gonna end her suffering tonight. I really just wanna like hug her, but if she goes down, she's taking me with her. This is the sweet mare that was at the auction. Her front legs are completely bowed. I have no idea how they got her here with the amount of pain she's in. She is on heavy pain medications because as soon as we were able to get her, we gave her IV pain medication. But Casey and I were talking, and she's suffering. She's in insane amount of pain. We talked with Dr. Lydia, and she backs us up on the fact that this horse cannot make it on a trailer ride home. So we are working with a veterinarian on site here, and we are gonna give her the last act of kindness. We could not let her leave us without a name. So normally we would let our fans name her, but in this case, we have to let her pass dignified. So we have decided to name her Rota, which is Spanish for broken, and unfortunately that's how her people left her. But we are gonna make sure that her suffering ends tonight. Do you need to come home with me? Okay, listen, excuse me, I'd like to, hi Mama. So she is dehydrated. Luckily she does have milk, but probably from lack of care, and baby's taken everything out of her. We were really concerned that we were gonna have to take him to Tennessee Equine tonight, and Casey and I were gonna go. But once we were able to get our hands on him, he is really feisty, so that is good. He is eating hay great, he is nursing great. He looks to be probably closer to 4 or 5 months old, so not as young as we originally thought. And they're drinking water great. So our focus is getting mom rehydrated tonight, as well as giving her electrolytes. And then they are gonna ride by themselves in their own little section tomorrow on the way back. But he is looking pretty good, feisty. They just need weight, and that's not something we can get on them tonight. So. He's so cute. He said, I'm just a baby. I got little baby teeth. We're gonna do them first just because his immune system isn't going to be great. So we're gonna do him before we handle anyone else that may be sick. And they are by themselves too. But he said, I'm just a baby. Oh my goodness. Just a baby. Whoa. We are going to give rectal fluids. You can give IV fluids. However, you gotta think, even if you had them fully open, IV fluids, even through a 14 gauge catheter, is going to take a decent amount of time. And so this is going to be the quickest way. We also infuse them with electrolytes. And so we are going to make her feel a lot better before tomorrow. This is lube. Yeah, it's powder lube, and then it gets real lubey. Let me know if her demeanor changes, Keith.
So far, she's doing good.
Can you hold that?
Yeah, she's wondering, her ears are starting to pin, but...
Excuse me?
Her ears are starting to pin, what?
Well, she's just looking back right this moment, I guess.
Good girl.
How we feeling up there, Keith?
She looks good.
Okay, so give me a little bit of pump so I have some liquid going in. It went pretty good. We just took it slow so that way we didn't stress her out. But we have seen horses.
Please be careful.
Ew. I don't want to be here anymore.
No, stop.
So it went really well. We took it nice and easy. We didn't want to stress her out. But one bucket for her like that will help her feel a lot better, especially because we gave them hay. We want to make sure she could eat, but we wanted to reduce any risk of colic. So we wanted to make sure we got fluids on board. She's got a brand new full bucket of water as well. We are making sure baby is nursing. As soon as we got him back here, he did. So we're gonna take the halter off of him and then just let them kind of relax a little bit and not be stressed. But he's eating great, she's eating great. And so I think they've had a crummy past, but we're pretty positive about their future. Our job is really hard, like when we have to advocate for our patients to euthanize them here. And sometimes our job is really good and we get to save lives like this one. Now that we took care of him, we can go assess the rest of them. So we have, this is wet, it's gross. We have a miniature with a locking right stifle, a pony with a hurt right leg, a gelding with a hurt left leg, a lot of little ponies this time. We have a mare, a 4-year-old mare that rode really well in the auction, but has a huge wound on her face that we weren't able to assess before. So we're gonna go assess that up and see what's going on with that. And then we have one with a squinting eye. So it is nice that we are able to come here and give them some pretty strong pain meds, especially for the ones that need it. And then we are able to relay to the team in the morning what follow-up doses they may need. So they can get really comfortable on the way home, and then we'll be able to assess them as soon as they get back. This little nugget is gonna get some Banamine, so that way it's IV, it's instant relief. This one's also drinking great, went straight to the water bucket, so we're gonna refill that again too before we leave. So this sweet horse has what I think on first examination is an abscess on the face, possibly a tooth root abscess that communicates with the sinus cavity because there's nasal discharge coming out of that side. But if that's the case, there's a good chance that we can fix it, and then we're gonna have a really nice young riding horse if we can make her feel better. So she's pretty young and nervous, understandably. And so since we don't have all the stuff to flush it here tonight or start our antibiotics, we're not gonna work her up with her face because it's gonna be painful. So we're gonna give her some pain meds tonight, and then when we get her back to the shelter tomorrow, we'll have Doc assess it. And that way we can fully debride it, flush it, see what's truly going on, and then really get her on the mend. So when we see horses that their eyes are shrunken back, a lot of the times this is what happens is they rupture and then they shrink back.
The auction's over, the horses are settled. We rescued 21 tonight.
That's amazing.
That's pretty awesome, but not all of the horses are doing great. What are you seeing tonight?
So we have one that has a ruptured abscess on its face that I'm hopeful is just a tooth root abscess that we're gonna get looked at by Doc tomorrow. We have a really sad mini. I don't know why it affects minis so bad, that just have the bended over front leg, but got pain meds on board with that one. And then we have this sweet draft who looks like it's been worked hard its whole life, has a really hunchy back end, and we're giving pain meds immediately on this one as well.
And then we also had one that we actually had to put down tonight. There was a vet still here, and thankfully, and we were able to put this horse down. It was in so much pain, it would have been inhuman and abusive to make it get back on the trailer and take another trip. So the horse was put down tonight to relieve its suffering, and the auction staff were like, it's been like that for a while, but overall everybody was so horrified when they saw this horse. It's like inconceivable how bad this horse is suffering.
That horse could have been like that for a long time, but we did what was best for the horse once it was in our possession.
Absolutely. And but 21 saved, and we're gonna get they're all settled in now, and we're ready to get a few hours of sleep. Probably maybe 3 for you.
Probably, but it's okay. We're ready to save some more lives tomorrow.
And then do the assessment in the morning.
It has been a crazy 24 hours, but we're at the auction. We rescued 21 precious horses. Sadly, one of them did require the last act of kindness last night. It was in just such horrific condition and suffering. But we're here this morning, and we're gonna get everybody else moved back to the shelter, and I've got my apples, so I'm gonna be friends with them right off the bat and know that, hopefully they know that I'm a good person if I bring them apples. So we gotta get busy.
Doing good. Got about, maybe 4 hours of sleep last night. So I'm bright-eyed, bushy-tailed, ready to go.
There you go. I figure introducing myself to these horses with apples, they're gonna know that I'm a good person and like me. Because I did get kicked really bad here at an auction one time, and I was like, these horses need to know right off the bat, I'm nice.
Oh! He took the whole thing. So I'm just giving them some apples, and well, he just took the whole thing. So yeah, didn't mean for that to happen.
This mom and baby are they're in critical condition. If you look at the baby looks pretty decent, but the mom has literally given everything she can to keep her baby alive. She also has some health problems going on, but I don't think that would be related to her weight. It's just basically her body is giving everything it can to her baby to keep her baby alive. And clearly she was not being fed even though she was feeding her baby.
So we have a few horses this morning that need some pain management. So I'm gonna give them some Butte paste. We got one that's got an abscess on the side of its face that blew. It's a little skittish. I did get some handling on it yesterday, so hopefully today it'll be a little more compliant. Well, hi there.
Hopefully it's just like a tooth abscess.
That's what Jenna thinks it is, and that's what she was saying yesterday. She thinks that the nasal discharge is pretty evident of that. So she says we believe that we could fix her up. We're gonna get it all cleaned up and scrubbed when we get back to the shelter.
And what's nice is we do have the x-ray machine, and that will be able to tell us what's going on. If it's a tooth abscess, maybe she's got a huge splinter in her face that's causing. I mean, you just never know.
It could be anything.
You never know. So Corey is giving the horse Sin-Chill, and Sin Nutra is one of our sponsors.
And that ulcer was not there last night.
No, it had to have been. So this horse is suffering from sunburn. If you look all over her nose and over her eyelids, she is suffering. So if you own a horse with white or pink skin, you have to take care of that skin just like we would take care of our own skin. Fly mask with a nose covering helps, but this horse is definitely suffering from sunburn. That's miserable, baby. Ooh, yeah, look at that.
I hate ticks.
There is a ginormous tick.
So Medicine Hat is just paint with pretty much a full white face and a little bit of markings up on top.
Like it's got like a little hat.
Yeah.
And supposedly they were special horses. So this horse probably has a rotated coffin bone in its left front. We're gonna need x-rays on that.
This one came in with the other one last night that just had those horrible knees. And this one is better, but still in horrible condition.
They may have been being ridden hard or they had an injury. And there's like arthritis that starts developing. Like I know one person commented and said, oh, there's fluid on the horse's leg. That's rock hard because it's usually bone calcification that comes up in the joint. So basically an x-ray is gonna show us that that horse has like no movement, probably much at all within that joint. And then a lot of times if they do have movement or limited movement, and it's a mare, when they're moving, sometimes they can actually chip that bone fragments basically loose, and then it causes excruciating pain. She has an old scar here, and This could have been an old scar that created this problem, or it's a pressure point. So I'm gonna say probably I'm gonna go with the old scar. But it's just really, really sad when we see cases like this. This horse's back has some major issues. It actually looks like it comes back and twists. That's really, really sad. This horse is just so skinny, it has extra skin. So it has fat pads back here, and then with donkeys and mules and some horses, you'll get excessive fat pads there on their rear end. So most likely, that's stiff, most likely it broke its leg and it healed in this position. But x-rays will tell us a lot more.
89871.
So I can't really even bend its knee. So there could be some major tendon issues that's created this, along with an injury would be my guess. I'm sorry, baby. There was years ago that we got a pony similar, but it had a severe club foot, and we actually had the veterinarian do a surgery where they cut the tendon in the leg to release the foot forward, and then the pony had to wear a special shoe, and we did get the pony walking correctly, but that was just a contracted tendon issue. So when we take x-rays, we'll be able to see if there's bone problems. If there's bone problems, then we're looking at a whole different ballpark of issues. So sometimes there can be just tendons that were, it was a birth defect. Or there's bone issues where there's nothing we can do and the pony's suffering. So that's something our veterinarian will decide. That's when we go to auctions. We used to, years and years ago, I would go and I'd pick and choose, well, I can't rescue that pony because it might need euthanasia and I'll rescue this one. We used to turn a blind eye to animals that we didn't think we could adopt. And we realized how we were rescuing horses wasn't okay because they all need help, and it's our job to help as many as we can. Okay, there's a baby and a mama. The mama's very, very skinny. She is so emaciated.
So she's a body score of 1?
I would say so. Her belly's kind of full, but she could even be pregnant again if she was running with a stallion. But she is very, very, very skinny.
It does have a bad back right fetlock. You can see it when it walks.
Look at that back right leg go. That's a feisty little guy. Feisty son today so far.
That's a good thing he's got one good eye.
Look at that other eye.
Very sweet though.
So usually with cases like that is the eyeball has actually dehydrated, basically, to nothing. And there's sometimes the eye that, what's remaining needs to be removed, and sometimes it's better to leave it alone. So the veterinarian decides what's the best option. The auction assessment is done. We've got them all sorted. Everyone's ready for transport. And it went pretty smooth, but there are a lot of horses in really rough conditions, so it's pretty sad. As soon as we know that they're all going to ride safely together, like they're happy in pens together, we're gonna be loading them up into trailers and heading back to the shelter. It's about 2.5 hour drive. And then once we get to the shelter, Doc is going to be our vet during the auction intake at our facility today. So I'm going to send him all the information and get these horses all the help they need.
So we have all the horses loaded now. We're gonna start bringing them back to the shelter. It all went pretty smoothly today. There was a blind horse that needed a little bit of extra help getting on there, but looks like they're all riding comfortably. So we'll get them back, get the vet to look at them, and figure out the best option for all of them.
We just got the 20 horses back to our shelter, and now the intake process is going to take place. We do have a number of critical horses. From one auction to the next, we never know what we're going to encounter. And this auction rescue definitely had some really critical horses. So we're going to do the best we can for them, regardless of the outcome. She's given everything to keep her baby alive. The baby looks pretty good compared to the mom. This one has a hind leg that's really not working. So we're gonna have Doc look at her and see, but it's usually not good.
I'm thinking the hip's out, really. Dislocated hip.
Doc just sedated this horse. Can't use its hind leg. He's gonna put it under anesthesia and then see if we can examine that leg better. It's looking like it's an old broken leg, and that's really bad.
I can move the knee. We have flexion there, that's what you're supposed to have. Yeah, it's a hip.
It's a broken hip.
Broken, yeah.
Unfortunately, there's nothing we can do for this pony, so we're gonna go ahead and give her the last act of kindness.
She does appear to be blind, but other than that, she just looks like she needs some weight put on her, maybe soaked feeds for being senior feed, and then hopefully we can get her up to weight. But other than that, she looks really good.
I didn't get any light response. We may get Keith to look, if Keith can lead her out, we'll take another look at it.
I feel like she may see some shadow only because she was like trying to run away from me last night. Like or she just senses.
Look at her mane, it's so beautiful.
Doesn't have a front leg.
Oh man. Can we lead her out? Does she leave? Do you know?
Oh yeah.
Let's lead her out, take a look. I don't know whether she's broke her epiphysis or, but we got to get an x-ray and see. We've got a fused joint and it's fused the wrong way. She's not that old.
This little pony is in pretty rough shape. Can't use its front leg and it has no movement in it. So we're gonna try to get an x-ray. Hopefully our x-ray machine will work. We've had a lot of trouble with it recently, which is really sad because we need it to make diagnosis so the vet can look at it and say this is what's wrong. And then we know if it's fixable or if it's something that we can't fix. So we're gonna give it another try. We've plugged it in. We tried to use it earlier and it wouldn't work. So we're gonna try again.
I don't know why it's fused. It's not broken.
Is it a contracted tendon?
We've got some extra bone back there. The sesamoids they look injured. And that's, they pull, the tendon pulls on them and pulls them back. That severe contracted tendon. I didn't see, that's why you take x-rays. I didn't see the break I was expecting. But we've got some scar tissue at the back. No fractures noted, possible contracted tendon.
So we're gonna hold off on any further evaluations, just giving this pony everything it needs electrolytes wise, and we're gonna reevaluate on Monday, because sometimes there are surgeries that can potentially, we've had another pony with a similar situation and did a surgery and it did correct it, but they have to wear special shoes for a while, so we're gonna research all that before we make any decisions. She's neurological and a lot of DSLD.
She does. What you got neurologic, is she?
I think she is. The way she like ran in the ring during the auction, and she was like she didn't have control of her back end. Yeah.
And it might be just, I mean, the DSLD is so advanced that she's got so much problems, but
Yeah, that's sort of
there's
a
a lot
neuro
going
disease.
on there.
Oh wow, that's a 90-degree angle. And, okay, come in close.
Okay.
Since you're supposed to be able to squish this out. We've got arthritis before and after the joint, and look at that 90-degree ankle. You're only supposed to have a 30 to 45 degree. The tendons have relaxed so much that she's hitting her thing there. See if you can hit a vein on her. And this DSLD is a neurological disease, and she's got some other neurological problems. So we're going to do the last act of kindness on her.
So this is a 15-year-old Molly mule. She's got a mass on her chest that we're gonna look into further at a later date. But other than that, she got some fatty deposits on her, but she's really sweet. Corey likes her a lot, and we'll see what comes of her.
I'm giving a little tranquilizer because we're going to try to get a couple x-rays on her head. And she may not like all that machinery around her face.
Okay.
Yeah.
So what do you want to do? Just lance it and send some gauze through so it can drain? And
I don't
then
think we can put it. We can sure try to put a needle in there and see what we got. But I think it
it's
needs.
hard.
Yeah, it's hard. I think probably. And I'll be thrilled to try to stab that with a needle and see what we got. Probably what we're going to have to do is trank her and take Ron's yours and just get all that bone out of there and pack it then.
Doc is actually flushing this. Basically, there's a hole that goes from one side of the horse's face up through the other. And he's flushing it with iodine. So it looks kind of rough, but it's actually going to help relieve some of the pressure and clean out the injury.
It's an antibiotic powder to just help get in there and...
Killing infection.
I know. You're fine. Just antibiotics to help if there is infection, but not any steroids in case there is ulcer.
The office crew went on ahead and took 2 off our hands.
Well, isn't that rude of them?
So thank you, Shirley from Texas. She donated pizza to our auction intake team. We are so thankful, we are so grateful, and we are all hungry. So thank you so much, Shirley.
Shirley from Texas. Thank you, Shirley.
Yep. Shirley, we love you wherever you are. Veggie, no. Cheese. Oh, you got one.
And I got thin crust too, Doc. Thin crust pepperoni.
Uncle.
Hi, Corey.
Yep.
It's a hematoma. That's going to go away.
What's that?
See that bubble in there? That was blood. That bubble wouldn't be running back and forth.
Oh.
And see how thin it is?
So you think she got kicked?
Oh, wow.
I think we got kicked. Oh, look, we got a few little clots in there. Yeah, we got kicked on the chest. Give them time, let that coalesce, and it'll go away. You know, looking at horsebacks is not something you do every day, but this is scar tissue. And the scar tissue going up, the spinal processes are supposed to be separated, but we've got scar tissue on that spine. We got spine, the spine's trying to get damaged, it's damaged right there. It's trying to fuse and stabilize. I got a feeling that she used to pull real hard, and that's what she...
Her back's actually goes this way and then it
man.
turns.
That's almost as good as an x-ray right there.
Like she's actually majorly damaged in her back.
Major.
There you can see it goes that way and then it churns.
And I don't think any chiropractor's gonna fix that.
We're finishing up intake and we are taking in the mama and the baby.
"19 years, 9 months, and 18 days. What you think, little baby? Gotta learn how to pick up our feet.
They like it.
There you go. You can lead. Wow.
Oh, there's your baby. He said, "I'm stressed. I would like to go eat now. Thank you. I'm very stressed and I'm hungry."
We finally have gotten everyone done. It's been a crazy day.
It's been nice and warm today, and we don't usually stand this close together, but with all the sweat, we're sort of stuck together now, and we're gonna have to get somebody to hose us down and get us apart. It hadn't been as hot today as it has been, so we got blessed by that. Had a little breeze. We did what, 21 horses?
Well, 20 came. There was one that was at the auction that was put to sleep by a vet. This auction rescue is pretty rough.
And that is unfortunate, and we were sort of pondering the percentage that had to have the last act of kindness. And it was sort of a higher percentage than usual, but I don't think there was any hope for them. I don't think anybody anywhere could have done anything for them. So
We're just thankful we were able to rescue them, and they're not in the slaughter pipeline. And even though their owners didn't do the right thing for them, that we were able to step into that position and help those horses. So Jenna, what's it been like for you? I know you got like 3 hours of sleep.
It has been a long auction rescue. Last night was a really hard one. There's a lot of horrible cases. So that was probably the roughest one that I've been to personally. But intake was good. It was a little rough. It was our first time doing all of our paperwork and everything on the computer up here, so that'll take a little bit of adjustment. But overall, it was really good. The ones that we were able to save, I think, have a really bright future for them.
That's what it's all about. It's helping the ones that we can help find homes for and giving the last act of kindness to ones that need it and are suffering.
So thank everyone for watching.
Yeah, we couldn't do it without you all.
So mom and baby are loaded up because they are actually going to be in one of our giant stalls in the vet barn just over this next weekend, just make sure everyone's looking good. And so they get to be our first set to try it out.
So Peyton came yesterday. As many of you know, she has a rescue up in Erin, Tennessee, and we did a big shelter transfer. She came with the plan of taking about 4 horses. She ended up taking 13 and a dog. So they came with the transport today to pick them all up.
Well, that just happened.
Nobody wants to stay on the trailer. All right, everybody's on there.
So all the horses and minis, they're finally loaded up in the trailer, hoping that they can get adopted out when they get to their next home.